Welcome back to Parasitology. Hi, I'm Christopher. In this video, we are focusing on the Kinetoplastids. Our examples today are Trypanosoma cruzi, the cause of Chagas disease, Trypanosoma evansi and Trypanosoma equiperdum, which give us surra and dourine, and Leishmania infantum, historically called Leishmania chagasi in the New World. These organisms share some cellular architecture, but they do not share the same route, host relationship, or clinical consequence. For Kinetoplastids, the route is the clue. Follow the vector or transmission route, connect it to the host and tissue, and the diagnosis becomes much less mysterious. The flagellum may wave dramatically, but the route does most of the pointing. Kinetoplastids are flagellated eukaryotic protists named for the kinetoplast, a dense network of mitochondrial DNA inside their single mitochondrion. This is not a second nucleus. It's just mitochondrial DNA with an unusually ambitious filing system. The two teaching lanes in this video are trypanosomes and leishmanias. For Trypanosoma, pay attention to the route T. cruzi points towards triatomine fecal contamination and cardiac disease. T. evansi points towards mechanical transfer by biting flies. And T. equiperdum points towards direct venereal transmission in equids. For Leishmania, the high-yield pattern is sandfly transmission, promastigotes in the vector, and amastigotes inside macrophages and other mononuclear phagocytic cells. Shared cellular family, very different clinical addresses. Before we move into disease, let's place these organisms onto the broader parasitology map. They are eukaryotes, like their animal hosts, and again, inconveniently, like us. Parasitology is sometimes eukaryotes making life difficult for other eukaryotes. Within the practical framework used in this course, Trypanosoma and Leishmania sit within the class Kinetoplastia in the broad excavatin-style portion of the protist map. That taxonomy gives us a filing system. The clinical pattern still comes from the host, route, tissue, form, and syndrome. Keep this slide as orientation rather than a destination. We are locating the organisms before we ask what they do. This chart shows the breadth of the genus Trypanosoma. It includes African sleeping sickness and Nagana organisms, triatomine-associated T. cruzi, mechanically transmitted animal trypanosomes, directly transmitted T. equiperdum, and several host-associated species linked with KEDs or fleas. Tsetse-associated species form one major lane, although T. vivax can cross lanes. It undergoes development in Glossina in Africa, but it can also be transmitted mechanically by Tabanids and Stomoxys. Triatomine-associated T. cruzi gives us stercorarian transmission through contaminated bug feces. Mechanical transfer by biting flies gives us T. evansi and surra. T. tylerii also uses Tabanids, but it develops within the fly rather than relying only on contaminated mouthparts. Direct venereal transmission gives us T. equiperdum and dourine. The name Trypanosoma comes from the Greek trypanon, meaning drill, and soma, meaning body. The name reflects the elongated, twisting appearance. This slide is a generalized morphology map, not the life cycle of one universal species. In vector-dependent species, the metacyclic trypomastigote is commonly the infected form for the vertebrate host. The epimastigote is typically a multiplying vector form with the kinetoplast positioned anterior to the nucleus. The bloodstream trypomastigote circulates extracellularly and may be taken up during a blood meal. The intracellular amastigote is especially important for T. cruzi, but many trypanosomes do not use that stage in the vertebrate host. Transmission also varies. Inoculation during a bite for salivarian species, posterior station or fecal contamination for stercorarian species such as T. cruzi, and direct transmission for organisms such as T. equiperdum. So the form is useful, but it must stay attached to the species and route. Morphology without context is just a very elegant way to become confidently lost. Trypanosoma cruzi causes Chagas disease, named for the Brazilian physician Dr. Carlos Chagas. Dr. Chagas named the parasite cruzi to honor his mentor, Oswaldo Cruz. That's a remarkable bit of scientific history. Chagas connected the parasite, vector, reservoir, disease, and patient in a single body of work. The vector is a triatomine bug, often called a kissing bug, but the classic transmission route is not simply the bite. The bug bites and feeds and then defecates near the feeding site. Metacyclic trypanosomes in the feces enter through damaged skin or mucous membranes. The bug therefore adds insult to injury and adds some feces to both. Ingestion of the insect, such as in a fruit smoothie, has been documented as a method of transmission as well. Inside the vertebrate host, the trypanosomes enter cells and become replicating amastogotes. They later return to the trypanosote form and enter the bloodstream. On a blood smear, a curved or C-shaped trypanosote with a prominent posterior kinetoplast may be a useful clue. But the route and syndrome remain more dependable than artistic silhouette alone. For dogs and people, the major long-term clue is cardiac disease, myocarditis, arrhythmias, cardiomyopathy, heart failure, or even sudden death. Diagnosis may involve direct detection early in infection, PCR, serology, tissue evaluation, and clinical exposure pattern. If you wonder why prevention and One Health matter so much, Chagas disease can persist for life, treatment is not always curative, and consequences can be fatal. This is a classic One Health parasite. Wildlife reservoirs maintain the organism, triatomine bugs connect the cycle, and dogs and people may share the same environmental exposure. A dog with Chagas disease is not ordinarily a direct contagion risk to the owner. The dog is evidence that the household or surrounding environment may also support infected vectors. The dog becomes a sentinel. In dogs, acute inflammation may be subtle or severe, with chronic infection that can produce persistent myocardial injury, conduction abnormalities, arrhythmias, cardiomyopathy, and sudden death. The quiet phase can be deceptive. The patient may leave the bloodstream, but it has not necessarily left the story. Treatment in dogs is challenging. Anti-trypanosomal protocols are not well standardized, and established cardiac damage may not be reversible. Management, therefore, includes careful cardiac evaluation and treatment of the resulting dysfunction. Prevention is built around reducing contact with triatomines, improving vector exclusion, and recognizing local and travel-associated risk. The memory line is simple. Triatomine exposure plus dog or human relevance plus a cardiac clue equals think Chagas disease. Now we move to two members of the Trypanosoma neighborhood with very different travel plans. Trypanosoma evansi causes surra and affects a broad range of domestic and wild mammals. The major route is mechanical transmission by biting flies, especially tabanids and stomoxys. Clinical expression varies by host and may include intermittent fever, progressive anemia, weight loss, weakness, edema, poor performance, and sometimes neurologic disease. Think many mammals and a contaminated mouth part rather than a complete developmental cycle in the fly. Trypanosoma equiperdum causes dourine in equids and is transmitted directly during breeding. Dourine comes from the French word meaning dirty. It is primarily a tissue parasite and may be difficult to find in peripheral blood. The classic pattern includes genital edema or discharge, transient raised skin plaques, neurologic deficits, progressive weakness, and reproductive loss. Stallions or mares may transmit infection even when clinical signs are limited. A useful contrast is Surra is broadly multi-host and usually biting fly associated. Dourine is equid restricted and venereal. Same general parasite neighborhood, very different epidemiologic real estate. The genus Leishmania was named for Scottish pathologist William Leishman, who helped identify the organism associated with visceral leishmaniasis. In the sandfly, Leishmania exists as an extracellular flagellated promastogote. The elongated promastogote has a single flagellum emerging from its anterior end, and its kinetoplast lies anterior to the nucleus near the flagellar pocket. Within the vector, promastogotes differentiate, and the metacyclic promastogote becomes the infective stage delivered during the sandfly bite. In the vertebrate host, promastogotes are taken up by phagocytic cells and transform into small, round to oval amastogotes. These amastogotes retain a kinetoplast but lack an externally visible flagellum. They replicate intracellularly, especially within macrophages. When another sandfly takes a blood meal, it ingests infected cells containing amastogotes, and the vector phase begins again. So remember the promastogote in the sandfly and amastogote in the host macrophage. Leishmania infantum is a major veterinary pathogen. The name Leishmania chagasi was historically used for the New World organism and is now generally treated as synonymous with L. infantum. The slash on the slide acknowledges that historical naming trail. Dogs are important hosts, and in many endemic zoonotic cycles, major reservoir hosts. Phlebotomine sandflies transmit infected promastogotes. Within the dog, the parasite shifts to the amastogote form and replicates in macrophages and other similar cells. The clinical pattern is often chronic and multisystemic. Weight loss, skin disease, lymphadenopathy, splenomegaly, ocular disease, epistaxis, renal injury, and other systemic abnormalities may occur. Some infected dogs remain clinically normal, so exposure, clinical findings, and testing must all be interpreted together. Diagnosis may use cytology or histopathology to find amastogotes, serology to document an antibody response, PCR to detect parasite DNA, and clinicopathologic findings to assess organ involvement. Dog plus sandfly plus macrophage or tissue clue equals think canine leishmaniasis. Leishmaniasis matters because it combines chronic veterinary disease with reservoir ecology and public health relevance. In endemic areas, infected dogs can support transmission to sandflies, which can then transmit the parasite to other dogs or people. Routine contact with an infected dog is not the usual zoonotic route. The sandfly remains the central bridge. For the patient, this is a long-game systemic disease. Dermatologic, lymphoid, splenic, ocular, hematologic, and renal patterns may overlap. Renal disease is particularly important for prognosis and monitoring. This is not merely a bite site problem that politely stays where it has entered. Management combines treatment of the infected dog, monitoring for chronic organ disease, and reducing sandfly exposure. Prevention and control vary by geography and available products, but the biologic target remains the same: interrupt contact between sandflies and susceptible or infected hosts. Let's close by matching each route to its organism. Triatomine fecal contamination points towards Trypanosoma cruzi and Chagas disease. A sandfly bite points towards Leishmania infantum and leishmaniasis. Mechanical transfer by biting flies points towards Trypanosoma evansi and surra. Direct venereal transmission in equids points towards Trypanosoma equiperdum and dourine. That is a practical rule for this kinetoplastid lane: route plus host plus tissue plus syndrome. Different vectors, different routes, and very different consequences. Well, that wraps up kinetoplastids and vector logic. Study hard and enjoy the journey. Thanks for watching. I'm Christopher Lee, and what you know today protects everyone tomorrow.